Good morning. I am so excited to come back to another episode of the Global Pandemic Midwifery Wisdom e-conference. And today we get to hear from a midwife in the thick of it. Trinisha Williams is the director of midwifery at the Brooklyn Birth Center in New York City. And I'm so excited to bring her on today. If you're new to my channel, I do these presentations every day with different midwives around the country, around the world, sharing their experiences, preparing for and responding to the global pandemic. Today, we get to meet with a wonderful and amazingly resourceful midwife in New York City, who's the director of midwifery at the Brooklyn Birth Center. So I'm really excited to hear from Trinisha today. Once we do these videos, I move them over to my YouTube channel. So if you haven't yet, make sure you go on over and subscribe to my YouTube channel. That's at Augustine Colebrook on YouTube. And a big shout out to all of the midwives around the globe who have come on to these conversations with me so far. It's been amazing. I just am so grateful for the midwives' contribution and their heart and their soul and everything that they share with us. We've talked to midwives in Bolivia and Mexico, Iran, India, Germany and Spain and UK and Italy. We've talked to midwives all over the United States, in Missouri and Louisiana, New York City, California. So if you haven't yet, go on over to my YouTube channel. You can watch all of them there, as well as the focus presentations that we do every week or so about a specific topic. So far we have water birth during the pandemic with Barbara Harper from Water Birth International. I have a telehealth video up, and then we have a panel discussion about unassisted birth during the global pandemic. This week, our structured conversation is with a panel of midwives who all have expertise in opening what we call emergency birth centers during the pandemic. So exciting to hear what they have to say. I know that England is moving towards taking over motels near hospitals to create birth centers, and we are going to be talking about lots of ideas in that. So that's coming up tomorrow, and it will go live the next day. So welcome to everyone on the call. So happy to see you all. Wave, say hi. Good to see you. I want to give a special shout out to everyone who's joining us. And Christina, are you feeling better? We have a midwife who did a presentation with us from Bolivia, who then got sick, very sick, and went to the hospital and is on oxygen. And I'm sending you so much love. I'm so sorry you're feeling yucky. When you're feeling better, we'll want to catch up with you. So there should be a little button for you to click that says join the conversation. And then we can have a chat. There we go. I think it's working. It says it's waiting for you and connecting. Yay!
Okay, good.
Yes. Hi, friend.
Hi, how are you?
Oh, I'm okay. How are you?
We're holding up as best we can here in New York. A lot of changes have happened. A lot of people are unfortunately losing their lives, and a lot of midwives are being challenged to sort of step up to the front to be able to support women as best we can, knowing that we've got these great dire situations.
Oh, well, I'm so grateful that they have you in leadership, and I'm so happy to hear from you today. But for people that don't know, can you just quickly do an introduction? Who are you? Where are you? How are you?
So my name is Trinisha Williams. I am a midwife in New York. I've been practicing midwifery since 2003. Most of my midwifery career was at a hospital. Some people may be familiar with it in the New York area, known as New York City Health and Hospital, Kings County. I worked there in the trenches with the public hospital system for 16 years. And then about 2 years ago, I transitioned to a different role at the Brooklyn Birthing Center. I am now the director of midwifery, so that's where I'm at. And then also in the middle, I did a little bit of home birth, which I still do, and I have a small home birth practice. So that's me. Yeah.
That's awesome. Well, so how are you? How is your spirit these days? I know you're being called upon in ways you never have.
Well, my spirit is doing pretty good. A lot of things are kind of going on in New York,
Yeah.
that could definitely make stuff a little bit easier for us. But it is, the hand that we've been dealt. This is 2020, the year of the midwife, and
Yeah.
it seems like we're definitely being challenged.
Yeah. Yeah. We sure are.
One of One of the first challenges we had was really recognizing this pandemic and all of our authorities, or whether it be our local or state municipality, understanding the importance of what we need to do, and then also recognizing the role of the midwife, particularly considering maternity hospitals or labor and delivery, as most people know them, and trying to figure out what our role could be there to help women, as well as alternative birth spaces. I don't know if everybody out there knows, there's only in the New York City area two birth centers, and currently the two birth centers are owned by physician-based practices. And in New York, the entire state, we've been advocating for several years to have midwifery-led birth centers, and there's been a lot of concerns about if midwives are able to run these centers adequately, and if there's enough interest. Is there patient interest? Is there midwife interest? Is there safety? So there's a lot of conversations that have been going on the last few years. Even a little bit divided, to be honest, in the midwifery community to figure out where birth should be and where we should best help women, and families out there.
Yeah. Well, so this is the situation that you came into the pandemic with. Do you think it's changing rapidly? Are there midwives who are called to serve more in the home environment? Is there anyone setting up emergency birth center options? What is the state doing with healthy, normal birthing people right now?
Well, we have a state chapter, New York State Association of Licensed Midwives, and we have a great leader. Sasha is doing her best to sort of help handle the more, health response in terms of our elected officials and other health authorities wanting to know where midwives are and what our roles are. And we've been all trying to find the next space to be able to help our women as best as we can. So we've been doing a lot of different things. One is recognizing first the need for PPEs, because in order for us to give help to other people, we have to first protect ourselves. And we unfortunately have not lost any midwives, but we have had a few midwives in the New York City area become positive, particularly our ones at larger hospital facilities where they may not have been as much PPEs, or maybe initially we didn't all recognize what was happening. There are a variety of things that had happened. Some of our midwives are at these larger public hospitals. Midwives typically care for those who are a little more disenfranchised, and we work in those types of facilities. So that, created a different environment for us to figure out how we can best support pregnant people.
Now, for you specifically at the Brooklyn Birth Center, are you getting more calls? Are you taking more clients? What's that look like?
So we've been getting a lot more calls for women who want to transition out of the hospital to maybe have an alternative birth site, to maybe consider delivering at a birth facility. But one of the challenges is that some of these women may either not be medically sound, or two, may be really close to their end date. For the most part, we would normally take a woman with documented prenatal care until 37 weeks. But with the pandemic, we've had to sort of change where we're at to be able to meet the needs of these women, because some of them really are low risk and they're motivated, and they thought this may have been an option, but the care provider was someplace, or they lived a certain place, or maybe they even had came to the birth center, but our location may not have been convenient. New York City is an area of 5 different boroughs, and sometimes people want to stay within their own municipality and don't want to necessarily go to the next location. But they'll travel to the next location for work, but maybe not for birth. So it's a little bit of a challenge for some women.
But you're getting more calls.
Definitely. I think when I spoke with Dr. Verdiana, in a 1-week period, our call volume had literally gone from as little as 20 inquiries to about 162. So that's a lot more. And we don't necessarily have any more midwives that are there to, meet those needs. We've also had a few of our private practice midwives reach out to us, because our birth center is an open facility, meaning that any midwife could apply for privileges, It's just whether or not that's something that you wanted to do as part of your practice. And we've had a few of the private practice midwives who would work normally at a hospital to care for their patients reconsider that because their patients are wanting to have alternative birth environments. They're concerned about transmitting an infectious, process when they're at the hospital delivering. And they're also concerned about the support their partner or doula may be able to provide. Some of our New York City hospitals are allowing for a labor support person. Some are not. It just depends. And some have a little bit of rules about when this person can enter the facility if they are healthy. And we've known so far that a couple of partners might have been stretching the truth a little bit in order to be able to be present for the birth of their kid. So
it's
that creates a new challenge
issue.
in this whole situation.
Oh, so complicated. My heart goes out to all of those families in that situation. Yeah, and we saw that the governor of New York made a statement that actually hospitals should allow partners. And
that's why he did, because so many women were changing and advocating and voicing their opinion that they had to, he had to put an official statement out. Now, just because that's a statement doesn't mean the hospital has to respect those measures. They still are sort of open to doing whatever they deem to be healthy to protect their staff, and rightfully so. I mean, one of the bigger studies came out of one of the big hospitals in New York Presbyterian, where there was a positive mother that was found after a cesarean when she had no symptoms, but I guess had been laboring long enough to recognize that something may not have been as right, and that then put the whole staff in jeopardy when they rushed in for a procedure to help, with that mom's life. And unfortunately, some people might have contracted. They didn't really reveal that side of it. Yeah. But when you expose the medical team, and we all know birth has a lot of fluids involved.
Yeah. It's messy.
So,
yeah. Yeah. Well, so speaking of that, do you and your staff have the PPE that you need? What is your new protocol?
Yes, we have changed our protocols in a number of ways. When our families are still pregnant, what we would do is have more televisits. We've written a new protocol where they would have televisits every trimester, and then at 37 weeks, they would have weekly visits until they deliver. And when they have these visits in between, like you would do 4 weeks or something like that, it would be televisits. So we are using 2 different apps to either talk to the patient with a video, or if not, because some of our families don't have access to that, a normal phone conversation, to still meet the needs. And in between, thank goodness our EMR has a patient portal where they can call the office and have questions answered. So that's what we're doing while they're still pregnant. We're also encouraging people to stay in their car, to call us when they're closer, taking temperatures when they arrive. And basically, when they do come in for an in-person visit, then we're just listening to the heartbeat and basically taking whatever labs need to happen and fundal height and kind of getting them in and out within probably 5-10 minutes. And then again, calling them for any follow-up and rescheduling of appointments and not letting them sort of stay in our office space. Because, the longer you're around somebody or closer you're with them, more likely we can maybe transmit this virus.
Yeah.
And when they're in labor, they would come with their labor support person. We ask that they bring additional garments so that they can change out of whatever clothing that they're in. Of course, take temperatures. Of course, ask all the signs and symptoms. If anybody does have any temperature, of which we do take, then they're asked to leave. We're taking temperatures every 12 hours on any person supporting them. And we are wearing masks ourselves. Our owner, Dr. Verdiano, managed to, I don't know how, she worked a miracle to get some for us, because there are short supply in New York, and it's hard to get even if you have cash. They're all back ordered, or there's other people sort of price gouging or whatever is happening. Who knows what's going on with this?
Yeah, but you got some.
Yeah, we do, and we're offering them. We actually had a handful of our volunteers, about 2, agree to actually sew us face masks, so we can use that. They're not, N9s, but we can also use that because some people do find that the N9 is hard to breathe through, and if they use that, then they'll place a surgical mask under, and it's still a good barrier, but, N9 is, we all know where we're at with that.
Yeah.
So.
Well, so what are you doing personally to take care of yourself in these crazy times? Are you working too many hours? Do you have a ritual? Tell the midwives how you're staying so fresh and beautiful looking like you are.
I am trying to rest in between, not do as much stuff outside. Thank God my husband is pretty supportive, and he's making sure he's doing the runs for the lights off with hand sanitizers and toilet paper because it's real. And I personally am a big advocate of plants. So I have all my plants around me.
Oh, I love it.
So they've been kind of help keep me grounded. And my plants, this is my plant room. So this is all I do in here. So I can have my meditation spot. I also have my aromatherapy over there. I put that on to kind of help relax me. I would like to be able to get out and do more, but I'm just concerned by walking outside that I might get too close to someone else, and that may not be as helpful.
Yeah.
Sometimes I live far enough in Brooklyn where I can go to the beach. So I've been trying to get some walks in, but off hours because people are outside and I just don't want to be close. And I'm listening to the governor, and it's true. Families are out there 9 to 5, during the regular sunlight. So really late in the evening or early in the morning, so that I'm not, close to people, so that I'm not encouraging any issues.
Yeah. Wow. Yeah. How intense, how amazing. Well, I know that as director of midwifery at the Brooklyn Birth Center, you have had to scramble to rewrite policy and research and study all these things. Do you have advice for other midwives around the country as this wave comes towards them? What you've learned, what you'd recommend? What can you do immediately?
Well, what I would say is I first have to give a little bit of props to one of our midwives, Cara Caruso. She was pretty instrumental with helping to write our protocols. She's got a whole 10-page document, and some of it is based upon midwives just wanting to be eager and get involved, but we knew we had to get ahead of this. Yeah. None of us knew anything, and so we just kept looking for webinars, and thank goodness in New York, there's a lot of people out here talking. The American Association of Birth Centers has had a few different webinars come out, and we've been listening to that. We've also had staff meetings for us as a team every week so that we can share different things that we have coming out. So that's been a little bit helpful, but even the New York City chapter, they've put out stuff. When someone finds something, they put on a listserv for us. So we sort of stay connected in that way. So I would tell people to, just sort of stay out there and see what things that people are producing to kind of help them out.
Yeah. In terms of the actual practice of midwifery, what's something someone can shift their practice right now? Like for those midwives that are still used to doing prenatals like we used to, what's the first thing?
I would say I would just start with the hand washing and maybe even just wearing the mask. We have bought literally these white suits. I don't know what you officially call it. I would refer to it as a painter's outfit, like when they would paint a building or something. Yeah. Yeah. And it's a little cold and callous considering that most of us midwives want to be close to our patients. We want to touch them. Yeah. We believe in havening and softening, but we also have to be protective. And I like how my midwife friends have said that if we're not whole, then how can we be whole for others? So we have to first start with making sure we're healthy. Yeah. I would definitely say to start going to some of your agencies that you work with, whether it's your local chapter, your national agency. I'm quite sure their website has developed tools. In New York, to be honest, I've had people, even outside of midwifery, some social workers that we are connected with, send us links to different articles so we can stay on top of what's going on. Just sort of be connected in social media because people are telling you a lot out there. Yeah. Or, nowadays, really Google, you can start by reading that. I am surprised at some misinformation that's out there, how, people are thinking that we can still use a little bit of alternative remedies. Don't get me wrong. We can definitely use some herbal stuff to boost our immune system, but that shouldn't be our first line of, dealing with such a communicable disease.
Yeah, I think people think like, well, we can just take herbs, that's not maybe quite enough.
I mean, it's a good way to boost. I am a proponent of boosting our own immunity and getting ourselves ready. But when we're talking about this, we need to be a little bit more based in science and understanding the transmission and how we really need to treat those symptoms, which sometimes certain herbal things can be. But we can't just say, we take one pill and we're not going to get COVID. Like vitamin C, it's not going to stop COVID. It'll help build you up. So if you do succumb to it, but it's not a,
Yeah.
you know, an immunity to never get it.
Yeah, yeah. So the cleanliness, the PPE, the hand washing, all of that's so important. And then immune boosting can be, like you said, like a ground floor. I love that. Well, it's such a pleasure to connect with you face to face. Thank you again for the parts of that you share with us today, and for your hard work and your dedication in your own community. It's pretty exceptional. I'm so glad to know you, and I really, really appreciate you.
You're welcome.
If things change there, will you let us know? We could do another quick chat.
Sure. We're getting close to the curve, so you just never know what's going to happen. I'm hoping that this numbers will keep going. It seems as though it's stable from right now, what they're saying, and maybe they'll start to go down, and we won't get a resurgence, because that's the next conversation.
Yeah. Well, if it changes and you have something to share, we'd love to have you back on. And thanks again. Really appreciate it.